5 medical exams to avoid after 70 that could do more harm than good. There's a hidden truth that most seniors will never hear from their doctors. Every year, millions of seniors go for checkups thinking they're protecting themselves. But what if I told you that some of those routine tests, the ones your doctor says are necessary, could actually be putting you one step closer to surgery, a stroke, or even cancer? New studies reveal that up to 37% of tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, 99% of people over 70 don't know they're being overtest. One of those tests, number 1 on our list, actually causes 5% of all cancers in the United States, the same number of cases as those caused by daily alcohol consumption. You won't hear this in your clinic. You won't see it on a poster, but the truth is buried in science. And today, we're going to reveal it all. In this video, we'll reveal the 5 medical tests to avoid after 70 and the terrible truth about what they can do to your body. It's all backed by real science, and you won't believe what comes in number 2. Before we get started, tell us in the comments how old you are and if you've ever regretted a test or procedure. Do you think seniors are tested too often? And don't forget to like and subscribe to our channel for more videos like this. Now, without further ado, let's talk about the first test. Why it seems harmless, but can quietly ruin your quality of life. Test number 5, the bone density scan. It seems harmless, just a simple scan. No pain, no needles, and you leave knowing if your bones are at risk of fracture. But here's what no one tells you. After age 70, a bone scan often creates more fear than benefit. This test, officially called a Dexa scan, measures the strength of your bones. It is primarily used to detect osteoporosis. But in older adults, especially women, the results almost always show a lower density, even when there is no real danger. Because bone loss is a natural part of aging. Like wrinkles or gray hair, it happens to everyone. Yet, many seniors are pressured to take medications like bisphosphonates, which are supposed to strengthen bones but cause serious side effects like jaw necrosis or esophageal irritation. Millions of seniors swallow these pills every day for a risk that is often exaggerated. A study published in the New England Journal of Medicine showed that for seniors over 70, bone scans lead to massive overdiagnosis. They label healthy people as sick, and the psychological effects are enormous. Imagine being told your bones are fragile. It changes the way you move, the way you walk, the way you live your life. You become more fearful. You avoid activities, and this fear itself increases the risk of falling. It's a vicious cycle. And here's the paradox. Regular exercise and a good diet are far more powerful at keeping your bones strong than any medication. But if you believe your bones are weak, you're less likely to exercise. And that's how the scanner quietly steals your vitality. Rose, 74, is a perfect example. Her doctor sent her for a bone density scan. The result? Low density. She panicked, stopped her dance classes, and started medication. 2 years later, not only had she lost her passion, but she was also suffering from chronic heartburn from the medication. All because of an unnecessary test. Now, let's be clear. If you've suffered a serious fracture or have a strong family history of osteoporosis, a CT scan may still be helpful. But for most healthy seniors, it causes more stress than it helps. Test number 4, prostate cancer screening with prostate-specific antigen, or PSA. This blood test is simple, quick, painless, and many men believe it saves lives. But after age 70, the PSA test can turn a senior into a cancer patient, even when they're not in danger. Here's why. The PSA test measures a protein produced by the prostate. A high number can signal cancer, but also simple infections or benign enlargement. And guess what? More than 75% of positive PSA test results in men over 70 are false positives. This leads to painful biopsies, surgeries, and radiation. And the treatments themselves often cause serious side effects, including incontinence, impotence, and bleeding. Imagine you were healthy, a test says cancer, you undergo major procedures, and suddenly your life changes forever. A Harvard Medical School study concluded that for men over 70, the PSA test does more harm than good. Why? Because most prostate cancers at that age are so slow-growing that they will never kill the patient. Many men die from prostate cancer, not because of it, but once a test labels a man as sick, it becomes nearly impossible to ignore that result. You're tapped into the medical machine. Take John, 72, for example. His PSA test came back high. He had a biopsy, which was painful and risky. The results showed a small, very slow-growing cancer, but his doctor insisted on treating it. After surgery, John suffered from incontinence and lost his sex life. The cancer, on the other hand, probably would never have progressed. This is the tragedy of overdiagnosis. So what can be done? Most medical organizations, including the U.S. Preventive Services Task Force, recommend no longer routinely screening men over 70 with a PSA test. But too many doctors still prescribe out of habit. If you're an older man, the best protection is knowledge. Always discuss the risks before taking this test. Test number 3, repeated colonoscopies. Colonoscopies are an important, sometimes life-saving, exam. But after age 70, many seniors are advised to have them too often. In reality, a single normal colonoscopy can be enough for 10 years of peace of mind. Yet, some doctors recommend a colonoscopy every 3 to 5 years, even if you don't have any risk factors. The problem is that every colonoscopy is an invasive procedure. You must undergo anesthesia. A tube is inserted into your intestines, and this carries risks, perforations, hemorrhage, and complications from the anesthesia. In seniors, the risks increase significantly with age, and yet, many undergo these tests again and again, unnecessarily. A study published in JAMA found that nearly 40% of colonoscopies performed on people over the age of 75 were medically inappropriate. That's a huge number. Take 78-year-old Marie. She had a normal colonoscopy at 68, but her doctor ordered another at 73 and then another at 76. At the third, she suffered a bowel perforation. She had to be hospitalized for 2 weeks, and her health has never been the same. All because of unnecessary repeated tests. So what's the rule? If you've had a normal colonoscopy after age 70, in most cases you don't need to repeat it, unless you develop new symptoms or have a strong family history of colorectal cancer. Saying no may be the best decision for your health. Test number 2, the coronary calcium cardiac scanner. This test looks very modern and sophisticated. It measures the buildup of calcium in your arteries, which can indicate a risk of heart attack. The test is quick, painless, and many seniors feel reassured by taking it. But after age 70, this test becomes dangerous. Why? Because almost all seniors have calcium in their arteries. It's a normal part of aging. So, the CT scan almost always comes back abnormal, even when the person is perfectly stable. And what happens next? You're sent for more tests, angiography, catheterization, or even surgery. These procedures are cumbersome, expensive, and often unnecessary. Worse still, cardiac CT scans use high doses of radiation. And guess what? This test is estimated to cause about 5% of all medically induced cancers in the United States. Yes, you heard correctly. This test can reveal cancer, even though it's supposed to prevent it. It's shocking, but that's what the studies say. Take George, 75. His doctor suggested a cardiac CT scan to be sure. The results showed calcium. He then underwent an angiogram that led to a stent break. A few months later, he suffered a stroke related to the procedure. And yet, he had never had any cardiac symptoms to begin with. It all started with an unnecessary test. That's why many leading cardiologists advise testing seniors. The best indicator of your heart health remains your symptoms, lifestyle, and family history, not a number from a machine. And finally, the number 1 test, the most dangerous test after age 70. Number 1, the whole body scan or preventive CT scan. This may seem like the ultimate test, a comprehensive exam that sees everything, detects everything. Some seniors believe this is the best way to check their health. But in reality, it's probably the worst test you can do. Why? Because a full-body CT scan exposes your entire body to high doses of radiation. A single CT scan is equivalent to hundreds of X-rays, and it's estimated that this radiation causes about 29,000 cases of cancer per year in the United States. This represents about 5% of all cases. That's a huge number. Moreover, scanners almost always detect small, unimportant abnormalities. Nodules, cysts, small shadows. And each abnormality leads to more tests, biopsies, surgery. You're caught in a medical spiral. And often, all this for something that would never have had any consequences. Take Linda, 71. She paid out of pocket for a preventive full-body scan. The results showed a small nodule in her lung. She underwent a biopsy, which caused an infection. She was hospitalized and suffered. And in the end, the nodule was benign. All because of a test she should never have had. This is why major medical organizations strongly advise against full-body scans for asymptomatic lords. The risk far outweighs the benefit. So let's recap. The 5 medical exams to avoid after age 70 are: Number 5, the bone density scan. Number 4, the PSA test for the prostate. Number 3, repeat colonoscopies. Number 2, the cardiac calcium scan. Number 1, the preventive whole body scan. All these tests have one thing in common. They appear protective, but in the Lord's case, they often cause more harm than good. So what should you do instead? The answer isn't to do nothing, but to choose carefully. Testing should always be based on your symptoms, your history, and an open discussion with a doctor who understands the difference between prevention and overmedication. Sometimes the best health decision is to say no thank you. Now I want to hear from you. Have you ever had a test that you later regretted? Have you felt like you were overtest? Tell us in the comments. And don't forget to like this video, subscribe to the channel, and share this information with your loved ones. Because knowledge is your best protection.